Hi, I'm Christopher Allison, and I'd like to thank you for taking a moment to join me in this quick little video in the explanation of this new and life-changing technology. When was the last time you were able to sit with a doctor for a full hour who actually knew what they were talking about, got your questions answered, and found out what was really going on? Well, that is exactly what you would get when you do this full body scan with Christopher Allison. We have an hour to talk about your history, your supplements, your medications, your fears, your desires, and what it will take to balance your body so you feel optimized with lots of energy and vigor for life. Since you're listening to this video, you are one of the few people becoming aware of what is the most advanced body scanners available. We will map out a specific plan for you, your body, and your life habits to achieve the health and well-being, vitality that you deserve. What we will find out with this machine is impressive and life-changing. As you can see here, some of what we will find out is about cardiovascular and arteriovascular disease, what's going on with your cholesterol, left ventricle hypertrophy, insulin resistance, metabolic syndrome, microcirculation or the blood vessels, and also the large blood vessels, hepatitis risk, prostate issues, hyperactive child syndrome, cerebrum, thyroid, serotonin, dopamine, GABA, and so much more. Now let's take a quick look at some of the panels, what is in them, and how to enhance your balance and well-being. The cardio assessment shows us how your heart is beating, the electrical signal that travels around your heart, the condition of your arteries, the tendency of heart disease, and ventricle and heart muscle efficiency. You will get a score of the approximate age of your heart and vascular system compared to how old you really are. This is very interesting indeed, because this gives us the opportunity to see the kind of influence of inflammation and other aspects and watch you heal from that to become younger on the inside over time. Microcirculation is the capillary's ability to carry blood through the tiny little blood vessels and is very important as a guide to blood perfusion throughout your body, including your brain. Because after all, if the blood doesn't flow, neither will your memory. The stress score indicates the balance of your autonomic nervous system, or the fight or flight, and the rest and digest and rebuild systems, and your body's ability to mount the neurotransmitter response to get those jobs done. Body composition has to do with water metabolism, among other things. Is the water getting into your cells where you will be considered hydrating, or is it sitting outside the cells, which may be a byproduct of inflammation and mineral imbalances? How is your muscle mass? How about the fat mass? Where is that fat? How much is there? What kind of fat is it? Is it superficial, or is it inside the organs and glands called visceral fat? What is your calorie needs for sustainability? The vertebral score has to do with both the structure of your spine and the energy flow around the vertebrae. Neural network shows how well the nerves are firing from your spinal column to the tissue it is supposed to innervate. The lymph system is that clear fluid that bathes our tissue in nutrients and pulls the toxins away. Is it able to flow? Or is there stagnations? Are you able to detox appropriately through those lymph glands? Biochemical screening shows thyroid, some neurotransmitter response, minerals, and different hormone balances around the body. There are a number of screening markers, including insulin, metabolic syndrome, metabolic balance, inflammation, cholesterol, hepatitis tendencies, serotonin, GABA, dopamine, acetylcholine, which has to do with your brain and your memory and innervating your muscles, thyroid response, and more. In these next few screens, we will take a look at a very important component of life, ATP, which is the energy manufactured by the different organs and glands, including we can see the ATP that's made in different parts of your brain, your limbic system, your neuronal excitability, stomach, intestines, liver, gallbladder, pancreas, uterus if you have one, prostate if you have one of those. Once we have scanned all that there are in these sessions, we can take a look at what exercise and or the spa treatments that would be appropriate or maybe not appropriate based on your readings, and we'll give you a personalized dietary recommendation based on your body's feedback. Throughout your session, you can feel free to tell your story and your life experience that got you here. You can ask questions you need to understand the program being suggested. I will be guiding you on what your body is doing and what you can do to bring it back to balance so you will be optimized and feeling great. My training is as a doctor of Oriental medicine and a functional Western medical doctor, and have specialized training in brain and hormone challenges. During my 30 years as a holistic practitioner, I have seen over 15,000 patients, which gives me a bunch of experience to bring to the table. And I truly feel blessed to be able to live my passion, which is helping people, and be able to help people in the way that I do. And I look forward to seeing you and supporting you and your health and wellness goals. So thank you for taking the time to watch this video. I hope that it was interesting and that you have a great day. So take care. Bye-bye.